Hello everyone, welcome back to my YouTube channel. Myself Dr. Surbisani from the Dr. Surbisani Dental Series and Medical Videos channel. Now today I am gonna talk about another query which comes from your side as what are the important questions or how a BDS student can prepare for the LA Viva in case of a third year student and for the extraction Viva in case of a fourth year student in the Department of Oral Surgery. So today in this video I am gonna give you certain topics, certain important topics and the tips and tricks to clear your Viva in the Oral Surgery Department. So without wasting time, let's get started with the video. If you are a third year student and you want to clear your LA Viva, then definitely you have to read the LA, that is the Local Anaesthesia topic. A whole separate book is there, that is the Malamute book of Local Anesthesia. You have to go through that book very well. In the first chapter, it is the definition which you have to learn properly, like word to word definition, you have to learn that. Followed by the composition of local anesthesia. Already a video is out on my channel. You can check out the video in the I button regarding the composition of local anesthesia, which is very important. And in that video, I have already told you certain Viva questions along with their solutions. Why we do the middle aspiration or what happened when the aspiration is found positive, such like that questions are there in that video. So don't forget to check out the video in the I button that is regarding the composition of local anesthesia on my channel. Begin with the third topic, that is the ideal properties of local anesthesia. Fourth one is the classification of local anesthesia. Although the classification is there in the LA book Malamute, still you have to do the classification and the mode of action from the pharmacology book which you have to read in the second year of dentistry. So from that book you have to cover the two topics. One is the mechanism of action of local anesthesia. Second one is the classification of local anesthesia. You have to do the classification from both the books. One is from the KGT Dental and the second one is from the LA Malamute book. After that you have to go through the theories of LA. There are 5 theories which you have to learn and understand it very well. Followed by the another important question is the absolute and relative indications of the local anesthesia. Part is the pharmacology or the pharmacodynamics or the kinetics of the local anesthesia chapter is there. So in that you need to know the proper dosage, the calculation of the LA, that is all very important for your Viva. The parts of the needle, there are certain questions which are very important. What will happen if a patient is allergic to lidocaine? Or what you will do and how you will give the LA. So these are the certain questions which are very important. Like what are the local or the systemic complications of LA. Already a separate chapter is there in the book regarding the local complications of LA and the systemic complications of LA. So do read and go through the chapters very well. If you still want the notes of LA, you can contact me by any of the mode. Either you can contact me through my mail which is shown on your screen, or you can DM me on my Instagram with my Instagram ID shown on your screen. I will definitely put the link of my Instagram ID in the description box of this video. So don't forget to contact me if you want any kind of the help regarding the Viva preparation for the oral surgery. Back to the topic, we are on the important questions and how we can prepare for the LA Viva. Now after that the most important part has arrived, that is the techniques for the maxillary and the mandibular. For that you need to know the proper branches and the proper complete nerve knowledge of trigeminal nerve, facial nerve, maxillary nerve and mandibular nerve. These are the 4 nerves which you have to revise very well. Then only you can apply the techniques in the patient. Followed by that, there is the separate 2 chapters in the book regarding the techniques in the maxillary section and techniques of injection for the mandibular section. That is maxillary section techniques and the mandibular section techniques. This book is very important to read the techniques regarding the LA as notes type there in the book itself. You do not need to make any notes for the techniques of LA, right? So in the book, if you see, the proper headings are there, like followed, if we say a particular like inferior alveolar nerve is blocked, we are going to read that. Then other names are there, then what are the causes, then what is the location, how we can approach like 27-degree down, this, that, this gauge, 25 number gauge or whatever it is. A complete description in the form of notes and concise form is there in the book. So you need to go through the chapter very well. The failure of that particular LA, then what are the complications like hematoma, paralysis or the trismus, and how you will manage all these complications. Each and every stuff is there in the chapter only, and that too in a very concise way. So don't forget to cover it thoroughly. If you don't understand the nerve block or the local anesthesia, you can see the colorful diagrams which are present on the chapter in the book, and then you can understand that which nerve or which injection will help you to anesthetize which particular tooth. Followed by that, that's all about the LA part. To the LA part, there are certain other questions or the other conditions which are very important and which is termed as the medical emergencies in oral surgery. Again, there is the separate book regarding the medical emergencies to read and understand very well. That is also the medical emergency book of Malamute. Medical emergencies are very important to understand because this will tell you how to manage a medically compromised patient. Suppose someone is diabetic or someone is having a high BP, is having a heart disease, then how you will manage and how you will extract and how you will give the LA. So all these things are correlated and interrelated, and they are very important whether you are in 3rd year or whether you are in final year or whether you are in internship. This part of oral surgery is very important even for your upcoming dental jobs after BDS. Medical emergencies like syncope, diabetes, asthma, SABE, hypertension, hypothyroidism, heart history. So whatever the condition it is, status epilepticus, then how you can treat the patient when he or she is medically compromised. Followed by the extraction part, the definition of the extraction should be there, principle of forceps application, principle of extraction, principle of elevators. These are all very important part. Followed by the movements of extraction. This is very important part. And regarding this, again there is one video which is already out on my channel, that is regarding the movements of tooth extraction or movements of extractions of tooth. It is already out on my channel. You can check out the link in the I button. You can tap there and check that out. I will definitely put the link in the description of this video also. So don't forget to check out that. Now back to the topic. In the case of the extraction, the different types of extractions are there. Elevators are there. Apex locators are there. So the picture, their particular name, their particular role, what are the different types and mainly the movements of extraction. And the forceps recognition is very important. Whether this is the maxillary forceps or the mandibular forceps, mandibular anterior forceps or the mandibular posterior forceps. So these are all the very important questions that you need to understand and learn and go through it. Then only you can clear your Viva, at least the basic Viva. Don't forget to read about the clotting factors like what are the post-extraction instructions, what medication you give, what are the, in case of a pregnant lady, how you can deal and extract the tooth. He or she is medically compromised, then what are the blood investigations you will recommend to the patient. Regarding the extraction, either basic book is you can read it from Balaji of oral surgery, or you can read it from standard book like Jeffrey. So that's all about the important questions and the way how you will cover your topics for the clearance of your Viva, whether it's for local anesthesia or whether it's for your extraction Viva, and whether you are in third year or whether you are in final year. These are the important topics which are very important, and you need to learn and understand it very well. If you still have any query regarding anything in the oral surgery, you can contact me by any of the mode. Till then, that's all about this video. Hope you like this video, and if you like this video, hit the like button. Along with that, if you are new on my channel, do subscribe and share my videos. Stay connected to my channel and don't forget to subscribe and share my videos. Thank you for watching.